Hi, I'm Rosemary Ziemba. I'm from the University of Michigan School of Nursing. I'm a clinical assistant professor there. I teach the community health nursing course, and I also take students out on different clinical activities to a number of clinical settings. I'm really excited to have heard about all of the things that you were talking about. It's really impressive to hear the variety, the different doing in terms of being in the moment. That really made this moment very special to also understand where everybody's coming from and doing. And it's also really refreshing to talk with people who understand right off the bat about the holistic perspective without having to make any kind of convincing argument about the values of some of these things. So that's a relief. This is a belated Happy St. Paws Day. It was the only thing I had that was green yesterday were these green paws. So, is there anything in particular that people were hoping that I would address today? Front? Yes?
Just like if you... I'm Jill.
Jill.
Okay. If you had a pet, how you might be able to get that pet involved in the PAWS program?
I'll be covering that, yes. So Jill had asked if you had a pet, how would you get that pet involved in the PAWS program? And by pet, you mean dog?
Yeah.
Okay. And I will be talking about more of that. Okay. Anything else, people?
Is the PAWS program only for dogs?
Most of everything I'm going to be talking about is dog related today, and it's just this talk is dedicated to Charlie. That's Charlie there, and May was his guardian. Charlie was part of the inspiration, or actually one of the first ideas about trying to work more with connecting people with pets. This is my next door neighbor. When I lived in Detroit, I was just talking with Maureen and Nancy about our times closer to UD Mercy, and so I lived right next door to UD Mercy, and my next door neighbor, her name was May, and she was in her 90s, and she was very upset because her husband had just died after a prolonged illness, and not too long after that her dog died. And so she was in a terrible mood and spirit, and very sad, very fearful. And she'd always had dogs, and so she was one of the healthiest, even with her grief and the agitation that caused. She was one of the healthiest 9-year-olds I'd ever met. So I figured she had at least one more dog's life in her, and we thought about trying to find her a dog. So this dog, Charlie, was actually she wanted a Katrina dog. This was back after Hurricane Katrina. She wanted a Katrina dog. Charlie was actually from North Carolina, but so she accepted that. She reasoned that maybe Charlie had been somehow diverted from New Orleans to North Carolina. A student had found him as a stray when she was going home from University of Michigan for the summer. Her parents wouldn't let her keep 2 dogs. She already had a dog. So she had to bring Charlie up to the University of Michigan to live with her. Unfortunately, she's living in a small apartment, and she discovers her roommate is allergic to dogs. So then she had to find what she called even a foster home. She was willing to pay for the food. She just needed Charlie to have it. So I saw his picture, and I showed it to May. And I said, and I talked to the student, and I said, well, this is for a woman who's 90 years old and probably weighs 85 pounds. What is, I need to be really careful about what kind of dog to get for her. And she said, well, Charlie was the most gentle dog that she ever met. So that made me think, well, okay, I'll introduce him to May. So May took one look at his picture and said, oh, he has nice eyes. I'm going to try him and give him a chance. So we brought him over, and she was just going to foster because maybe the girl would want the dog back and all that, but he became her permanent partner there. He's a working dog. I call him, this is his deputy dog picture, because he really was a guardian. He's a good watchdog, and it meant a lot to May for her security to have that. But also, a lot of comfort and companionship. Charlie was a co-op dog, so to speak. I co-owned Charlie with my husband and with May, and we had a key to May's house, and our job was to, we would go and get Charlie every morning and every afternoon and walk him in the neighborhood, and we'd bring him back, and then May would do her job, which was to feed him incessantly in all kinds of things, which he loved, of course. So Charlie, we kept many pounds off of Charlie, and Charlie kept a lot of pounds off of us. So that was his plan. So about the same time, I was thinking about that and how connecting May with dogs was a great thing, and it was a feel-good moment. And also started looking at some of the student needs on campus, and I also want to dedicate this to them, to the students of PAWS of Ann Arbor, and I'll talk more about what PAWS of Ann Arbor is. PAWS, the generic. There are many organizations that are called PAWS. If you were to Google PAWS, you'll get all kinds of PAWS responses. So it's not a trademark. There are many different examples. They're in different places, different ways of organizing the sentences. The little paw prints I have here are not copywritten, and that's rather symbolic of the commonalities or the frequency in which you'll see PAWS kinds of names. PAWS in all caps for us means pets are wonderful support, but I've seen other uses for that. Another example is PAWS for a cause, and I will explain what some of the differences are, at least for these two organizations. But if you hear PAWS, you can't really say, oh, it's this PAWS or that PAWS or whatever. I had a phone call from someone who said, well, I just read about your organization in the paper, and I saw that you went down and rescued these 2 dogs, and that you were doing this and that, and I thought, no, I don't think that was us, and she went on, and then I was getting really nervous because my PAWS is a student organization, and I was thinking, oh my God, the students are doing this without telling me, and it was a panicky moment, but it turned out it was a completely different PAWS. So, definition of terms. There's a different sets of terms that are used in the literature and when people are talking about this topic. So there's 3 broad categories. Pets, sometimes referred to as companion animals, and from what I can gather in looking at some articles about this, also referred to as animal-assisted activities. Sounds a bit formal for a pet, but this would be the least formal of training for the animal. Pet therapy, referred to as animal-assisted interventions, or AAT, animal-assisted therapy. And this is where we're having more purposeful interactions to bring pets in contact with people. So there might be things like kids reading to dogs. So it's an animal-assisted intervention or some activity with a purpose, animal visits to assisted living or nursing homes, etc. But that's that category. The last category is service animals. And these are animals that have been trained, very highly trained, to provide specific and individualized help to individuals with disabilities. This set of the nomenclature is from the Iowa Civil Rights Commission, and I did bring copies of this fact sheet, and I'll refer to it later. This is on service and emotional support animals under the Fair Housing Act and the Americans with Disabilities Act, and I'll talk more about that later. But they categorize the situations 3 ways. Pets, those are those critters living with owners for purposes of love, affection, company. Emotional support animals, this is an important distinction between service animals. These are animals that are there for therapeutic benefit to people who have some kind of mental or emotional or psychiatric condition. And the animals themselves don't require any specific training, but they are there for the purpose of calming the person and as support, social support to that person. Service animals, they are, again, trained to do work or perform tasks for the benefit of someone who has a physical, intellectual, or mental disability. And the distinction is important because the service animals will be protected in terms of access to different areas because of the Americans with Disabilities Act. But the emotional support animals becomes more of a gray area, and there might be fewer protections for folks with those kinds of needs. But we'll talk more about that later. Many examples of service or support animals pause with a cause. This is locally one of the most well-known organizations that specially trains, matches dogs with people with disabilities. And they also do very wonderful presentation. If you're interested in something like that, to get a speaker, they'll bring the dog, and sometimes they'll also do presentations not only with the dog, but with the dog's handler or guardian. And those can be very interesting. Everybody knows about leader dogs for the blind, hearing dogs, early alert dogs. At least I'm calling them early alert dogs. These are dogs that would sense a seizure, or they can detect high blood pressure, and they become very specifically trained or helpful to a person. There's dogs that would be helpful for PTSD, post-traumatic stress disorder, people with severe anxiety or depression. And in those situations, they work as a social buffer or social navigator. Susanna was telling me that a speaker was here recently, a book called Until Tuesday, which was a story written by a veteran who had PTSD and was really quite crippled from the severity of his substance abuse and emotional issues, and until he got Tuesday. And Tuesday was the name of the dog that then became his faithful companion and really changed his life. So my cause, so to speak, is Pets Are Wonderful Support of Ann Arbor, and this is a student organization now. It's a volunteer student organization. Any student from the University of Michigan can join. It started first as a pilot program in 2008. This was with the small startup funding from the Ginsberg Center for Community Service and Learning. The vision was modeled after Pets Are Wonderful Support of Ann Arbor, and I'll go back to this link later. Pets Are Wonderful Support of Ann Arbor, Paws of San Francisco, is unique in, there are other places like this, other organizations like this, but they did a lot to provide in-home services to help folks with HIV/AIDS or with other serious illnesses to maintain their pets at home. And they have a really unique and wonderful program. So that was my big role model. I guess I can take us on a trip to San Francisco for a minute. They're dedicated to preserving the human-animal bond, which is another way in which these things are all described in the literature. They primarily will assist with dogs, and they actually have like a case management system. They have a case load, and they'll figure out how many dogs and how many cats they can support, or how many other pets that they can support, and they'll arrange to give them their food, their veterinary bills, cover that. We have some dogs here at the food bank. They have volunteers who will deliver the food, who will go and groom animals in the home. We'll take the animals for walks. And then they also have backup plans for when the people are ill. And they also provide a lot of linkages to other support services for the folks. It's a fun site to look at, to see. They have lots of cool stories in there about how they grew, how they developed. They have their signature event. I like to show this just because I like to do that. Which is when they have local architects design pet spaces, and they will auction them, and they have a giant, big party. Here's some of their past creations. Petchitecture. A little hard to say. Oh, I'm having mouse problems. My pet moms. So they have all kinds of interesting things. And it's a big gala event that they will have, say, in a department store that they will allow them to do this some evening in downtown San Francisco. It's very fancy. People get all dressed up and people bring their dogs to this as well. Oh, there's a cute one. So, again, it's I don't mean to be biased and talk so much about dogs, but somehow this all turned into a dog talk. I went to the dogs. So, let's see. Go this away. So when we started with the students, we wanted to see whether there was a need for this. The rationale that I had was I was interested in getting support services out to older adults and people with disabilities in the home so that they could maintain their pets. And that was my goal, was to try and do that. And I thought, well, what a perfect opportunity. We have all these students here that miss their pets because most of them are, coming to live on campus from far away. It's not a commuter school that much. So I thought this would be a great idea, and if I could only get the two together, that would be great. The students would also learn about how to interact better or how to have meaningful relationships with older adults and people with disabilities, and I thought this would be just a great thing. So we conducted some needs assessment to see if that was indeed what people wanted or if there was a need. We met with the Area Agency on Aging and did a phone survey on what people's needs were. We did the same with Neighborhood Senior Services in Ann Arbor, and the Ypsilanti Meals on Wheels was also where a student went in and found out how many people had dogs or cats or pets and what their needs were. And then our plan was that we were going to try and deliver some services. And then around that same time, the students, we moved from being strictly service learning or strictly, we called it service learning, but very often it was a requirement for students in service learning courses or other courses, like my clinical course to take part in this. So, at any rate, when we went to a volunteer student organization, the membership just blossomed. It grew quite a bit because we were getting students from all over and because they wanted to, not just because they were getting credit. What we found on the survey, the adults with disabilities were living at home, what their biggest needs were. Financial was a big one. We were trying to target low-income folks. And if you look at the average cost for veterinary costs for a pet, be about $400, I think. And I think we could imagine in certain situations where that would be even more. Food is an issue. Pet care. Simple things like grooming or cutting their nails, litter change. I had one lady who really just wanted someone to come to the home and clip their toy poodle's nails because she was on an anticoagulant, and her poodle liked to go like that. And even though the poodle didn't have really sharp, big nails, it was enough to scratch the lady and start up a good bleed. Litter change, people just could no longer get down to the ground or to work with that kind of a thing. Other kinds of things related to hygiene. Dog walking was a very frequent request, and also it was the thing that our students wanted to do the most. That was the most frequently expressed interest by the students too.
Except when it's 15 below outside.
Pardon?
Except when it's 15 below outside.
Yeah. Right. Finding new pets was also something that people wanted some help with because of the cost and also to locate the right kind of pet. Other kinds of pet issues, behavioral issues that some people mentioned. One of the things that we found when we talked to different agencies trying to figure out what the resources were, the Humane Society was telling us that there's no service that really goes into the homes to help people with their pets. So they were okay with us doing whatever we could for people in the home, but they said this is really, this is a big gap. Hospice was an exception because hospice in the area was taking therapy dogs. People were bringing their dogs into the homes there, but not so much in any other kind of home situation. Humane Society has Bountiful Bowls program that's free food from the Humane Society, but still somebody has to go and pick up the food. There's no delivery to the home. So people who are homebound, so to speak, were very limited at home. There's a problem with getting services to help them with their animals. And if you know of others, those of you who are in the home care field, to suggest some other ideas on that. Like I said, we knew that the student missed their own pets. This very often is the first time students are away from home for the first time in their life for any significant amount of time. Freshmen and sophomores, they're not allowed to have cars. They live in their, well, there can be exceptions, but most of them don't have cars. They live in the dorms, so they are very limited in access to pets. Of course, they experience a great deal of stress due to school transitions. So again, it seemed like a perfect match. Unfortunately, what we found is that we couldn't get the students out to the homes for two reasons. Students don't have transportation. They themselves didn't have cars. It was expensive for them to rent them or do other things. And it became such that we could only do animal-related events that we could provide transportation for or that they could get to on a bus line or whatever. The second issue that loomed large was safety and security issues for the students, because a lot of the animals that people that wanted help with their animals, for example, some who we might say had an emotional support animal, that dog that was so important for that person, the person might have had a long history of substance abuse, a long history of very, making some bad decisions or falling into difficult situations. And then we had to start thinking about, great idea to have these students go out to the home, but we have these other safety and security issues that we had to work on. And some of the places where people wanted help were in neighborhoods that then we'd have to think about what would the students do there. So again, it was a great idea in concept, but it really would need a whole lot more funding and organization to get students past those barriers. Instead, what it evolved into was the students creating social activities around the idea of animals and pets and the human-animal bond. They have, every week, they meet for some kind of a social activity. They'll have educational sessions, speakers like people from Paws for a Cause. We had a great speaker who came to talk about raising puppies for Leaders Dogs for the Blind and what that's about. We had some animal trainers, some dog trainers, dog psychologists, and things like that. And of course, we have our friends from Therapaws that also bring dogs and do that. Actually, they're meeting right now as I'm talking with the therapy dogs that I might have brought here, but unfortunately, they were busy. There's a lot of demand. Nobody ever calls me, and I can hear my phone. Okay. So now, Paws of Ann Arbor, Pets Are Wonderful Support, we do a lot of that. They do some service learning. They'll go out and do to different shelters and help with either fundraising activities or cleaning or animal care or animal comfort, socialization with the animals. They do fundraising and then donate that to organizations that help. But their contact with folks at home is more virtual and more symbolic. Here's their website. Welcome to peruse at another time. By the way, a student put this website together in 2 days for, I think it was less than $200 total by the time it was all done, and maintains it. They have a Facebook page, they have Twitter, they have all those things that I don't know how to use. This is one of the therapy dogs from Therapods, and there's other aspects here that our key event is Dogs on a Diet coming up. This happens in spring term. It's our 5th annual. If you're familiar with Ann Arbor campus, the Diag is a famous place, and it gets a lot of traffic as students go across to their other classes and things. The Hash Bash was held on the Diag, and some other, I think, let's see, is that where JFK also announced Peace Corps? So it's a very famous place. At any rate, Dogs in the Diag is a big event. We were allowed to bring dogs there, and it's a great day for the students to come through. This is the last week of school, so the students are pretty stressed out from finals and everything, and repeatedly, as they come through, play with the dogs, they'll say this is their favorite time of the year, favorite day, and they'll come through several times, and we'll have different teams. Somewhere there's a lot more photos of that. And it's pretty amazing to watch the interactions of the students with the dogs. They just mill about them and ooh and ah and pet them. And this is a particular therapy dog, Annie, who gives hugs. And so the students will be sitting there, and one by one, they'll get a hug from Annie. I'm pretty sure that's Annie. In a way, it looks more like a sheep, but it could be Annie. So it's a great day. These other pictures that are here are from going out to different pet sanctuaries. This is a rabbit sanctuary that also has some potbelly pigs, and the students go out there and help with animal cleanup and those kinds of things. There's rabbits. They play with the rabbits and the bunnies. So yes, we do address other animal needs. Somewhere here there should be a sloth, and I'm not referring to a lazy person as a sloth. This is from the Creature Conservancy, and this is where they have a lot of abandoned exotic animals, and so the students will go there also and help. Multiple different things. There's another cat shelter, mosaic cat shelter, where the students go and just hang out with the kitties. So they do a lot of that type of thing. Here's one of their other activities where they get together and they're making toys, cat toys or dog ties and other kinds of things that they then donate to different shelters. Or on occasion we've taken them out to IPSI, Meals on Wheels, or some of the other senior service settings, and then those drivers will deliver things on their route. Let's see. Another thing that they do in terms of virtual stuff, I feel like is they run these things frequently. Oops. This one doesn't like that. Oh well. But if you go to the website, I can do that. I'll show you. You can stop me if I'm off track here. But they run the Cutest Pet Photo Contest as well. And so this page recently, when they did it before, had about 250 hits of likes. And they'll through Facebook, they will vote for their favorite cutest dog. I love this guy who just lost his one eye.
No.
Yeah, but he's still very cute. We get lots of awe factors out of these. then they vote, and then the top winners, then they'll do a poster of the top winners, and then take that to either student union in some place that gets a lot of traffic, and then they'll have the students vote again, and then the dogs, or the pet that gets, wins the prize gets some kind of treat. There's, so you can see how the students put these things together, and how, oh, this is really getting so it's mostly dogs. Yes, that's true. There's that and cat videos and other things. I just wanted to show you that we do have a non-denominational policy. So somewhere in here, there is, oh, here's a sugar glider. So any pet's welcome, but like I said, some of them just don't travel well. And so having that in a virtual situation, I think this dog has been to Dogs on a Diet. And in here somewhere there's some others. Well, I don't know where they are. I love this caption here. This is Aria. She's about 7 months old, and world domination just tires her out. Her game. Anyway, somewhere in here, there are some other animals, but I'm just not finding them. We did have a bird. We had what's that little, a hedgehog was a very popular one of these games, or one of these contests. And another sugar glider in there.
I never heard of a sugar glider.
No. Either.
What is that?
Well, I think it's a mammal. I don't know a lot more about it. And now I've done something.
That's okay, just,
Okay.
Oops.
There you go.
Okay.
Oh, you're good.
I would have to Google what a sugar glider is.
that's okay, we'll do that.
But we've had ferrets and we've had other things and all kinds of things, but, okay. So, back to the substance of these things. I just put the screenshots in here in case I couldn't get a link. We get students from all fields. Sad to say, we don't get that many nursing students. I think we keep our nursing students too busy.
Oh, yeah, that's so.
It's, yeah. But we'll get a lot, we get many pre-veterinary students, of course, makes sense. We get anthropology, social science, biology, kinesiology, a whole lot of students from all over. Grad schools as well, we've had even a few PhD students. We had a paid, if you ever want to do this yourself, with trying to organize a student group, and we had contacts from some other schools that were interested. The thing that really jump-started us was having a paid volunteer organizer, a paid organizer of the volunteers for a short time. This really helped to get the students organized and to get the routine down so that they can now run this pretty much on themselves. I don't do a lot except if there's some kind of barrier with administration, then that's often when I jump in terms of facilitating. The science of pet therapy. It's also a relief to be here with people who are from the holistic health beliefs, because then you don't have to justify or the evidence for why this would be a good thing. To us, I imagine everybody in this room, to us it's self-evident that pets are important to people, that animals are important to people, and so let's help support that. But I usually start out with trying to say, well, this is part of why it's self-evident. Just look at the prevalence of pets, and this is just for the USA. But it's a pretty universal phenomenon. People have pets everywhere, different kinds of pets. Over 60% of American households include at least one pet. That's a lot of dogs, 83 million dogs. There's even more cats. So you can see that our pictures are not representative, but once again, dogs seem to be one of the most favorite animals for people to relate to and interact with. many other animals. We have students that have, and have rabbits. We had rabbits here. We had quite a few rabbit people, and some of these other animals are very good for, especially for apartment dwellers. Rabbits work very well in an apartment situation. They're quiet, and they. The students often have reported those make good pets. Some of these other animals, and we'll talk about that a little bit later. They're not your cuddly kinds of things, but still, as Jill was saying about her wild animals or birds, they're important to people just for the aesthetic pleasures in to be taking care of something. 6 out of 10 pet owners considered them part of the family. That's a lot. It says a lot about the significance of pets to people. So there's 2 main theory pathways, 2 hypothesized mechanisms according to O'Hare. Biophilia, that's just a fancy word of saying that we are hardwired to attend to and to be attracted to animals and other living things. And I really like this idea of also being to attend to. It's not just to be attracted to animals and other living things, but also to have a relationship with that animal and to help that animal or care for that animal. So that implies the reciprocity of caretaking and caregiving. You'll see this kind of philosophy as well in long-term care settings or other philosophies with Edenizing nursing homes, for example. It's not only to bring into the environment a more home-like natural environment to have pets, but also people don't want to be just dependent and always receiving. They also want to be able to feel that they are able to give to others and to other people, other animals, or whatever, so that's a good thing. Evolutionary purpose, of course, remember Charlie with his deputy dog license tags on. He's there for protection. Just having that dog made a world of difference to a woman afraid in her own house, in her neighborhood. And also, in O'Hare's view, is that there was so much survival related to this before in terms of protection and understanding the world around them. But now we're more just wanting to interact with nature. It's an important part, and needing to do that. The other big pathway is social support. Pets and animals are social support. And not only that, but they attract social support from others. The term that's used is social lubricants. But the idea is, and this is seen in lots of different ways, people may be uncomfortable going to talk with a person in a wheelchair. On the other hand, having this animal there, now it becomes something that's safer to talk about or makes for a more natural kind of interaction, and the attention is off of the disability, off of the wheelchair, off of whatever, and more on this animal in between. Partners in healing, other reasons, comfort and companionship, of course, protector, assistant, in terms of helping with different things. I'd like to say I had a working cat at home, but she just reminds me of how great it would be to be retired. Well, what are you going to do today, Lola? I don't know. Anyway, so trophy, this idea that people get pets of a certain breed or a certain type, and you want to show them off or say, well, look at this great dog I have, and get into that whole kind of situation of the beauty of the animal. The bridge, the animal, again, I mentioned that before about the social lubricant. Again, pets are often big bridges. And often I'll tell students, well, you're with a patient, and sure you can talk about their constipation and this, that, or whatever, but why don't you just talk about something else? Ask them if they have any pets, what's going on with that, and then they'll start telling stories about it, and it really changes things.
And they'll start crying that they can't be home with their pet.
Yes, they will cry. And it can be also, as someone was saying in the audience, that they can also then see the emotional side of that. I remember, what difference does it make? Was it 35 years ago? I don't have to count that up. When I was a student, I think it was a long time ago anyway, and I was in a nursing home situation, and this patient that I was with was very upset and was very angry, and everybody was saying it was because her husband had just died. And I had mentioned, shared some comfort and sympathy about that. And she says, oh, I didn't care about him. He was the meanest guy I ever met. She says, but my 2 cats, who's taking care of my 2 cats? So, anyway. That's, but I just don't think when you just see this kind of thing, why do we even have to talk about all those other reasons, biophilia or whatever? If people think this is their family member, their significant other, then protecting that relationship is important. What people often talk about is the unconditional love that animals provide, pets provide. And in this situation, the caption is no coincidence that man's best friend cannot talk. So that's that unconditional part. They don't care what you look like, they don't care what you smell like, well, kind of they do, but they're not going to criticize your clothing. They might tear it up, chew it while you're not looking, but they're not going to be saying anything about it. This scenario here is another example of unconditional love. This is the executioner, the drawing, and hard day at the executioner job. And here this guy comes home from a hard day at work, and the dog is happy to see him, and they go off on a walk. So not only is this meaningful to him, but you can see the dog is completely, therapeutic touch. I don't see this pulled out much in the literature about this. This is one of the students' dogs. This is one of her boys, Panuki, which means pampered or spoiled, and he loves being hugged. So don't see that so much in what people are talking about. Pardon?
Is that a miniature schnauzer?
I would guess.
Looks like mine.
Oh, cute. Yeah. So I think this makes a big difference in just that being able to connect with an animal, with something warm and fuzzy, often, to have that kind of connection. Because especially if you're feeling ugly or whatever, it might be harder to get that. I always think that I've got to pitch this program really hard with parents whose children are just coming to school for the first time. They say, look, you really want your daughters to be playing with a puppy, not looking for these things somewhere else. So,
looking for love in all the
wrong places. You don't know how many times I've seen it in the classroom. Anyway, that's my work theme song. Health benefits. There's a lot of literature about health benefits, and I'm not going to, I had a much more scholarly listing of these, but the PowerPoint, I could say the dog ate it, but it was the PowerPoint program that kept crashing that ate them, but a Google search will pull up lots of things. The most common disease targets and the effects that have been studied are cardiovascular health, most likely due to decreased anxiety and the whole cascade related to stress, and also to increased mobility. So the American Heart Association just came out with a scientific statement summarizing all of the literature and studies and research on hearts and cardiovascular health. And so there's pretty good support for the benefits. They didn't have anything, though, to say about, they didn't say you should go out and get an animal or a dog to prevent cardiovascular disease or to treat your cardiovascular disease, but definitely that it was supportive. And that also leads to part of that motivation. I think this is what we might think of as your pet as an assistant. The studies in which they show that having a dog and walking that dog is going to happen more likely because the dogs demand attention. They know that people know that the dogs depend on them and they need the exercise, so it becomes more motivator. Somebody said, well, they're not going to go out in 15-degree weather, but the dog will keep bugging and keep asking and keep giving the guilt trip so that we'll do that. This is not the study in Greta. This was, there was another study, I'm sorry I don't have the reference, where people from an assisted living and community arranged to have volunteers who would go off to the Humane Society to walk the dogs there. And they compared how much those people actually walked, their walking time and all, with other people who had a human buddy. People who had contracted together, okay, we're going to walk for a half hour every other day, and they compared to see what was most effective. And the dogs won because if one person didn't feel like walking, oh, it's raining, I don't need to go, why don't you just come over and get some tea and we'll watch the telly? Okay. So they really were partners in crime in that sense. The other big area that people look at is common disease targets and effects, mental health and behavioral disorders, decreased anxiety are the effects, decreased problem behaviors, dementia-related behaviors, and increased quality of life. So there's quite a lot of different diagnoses that people would be looking at with that. PTSD, autism, there's a lot in terms of dogs for kids, particularly dogs for kids. Again, I keep going into the dogs, but they probably are the most common therapy animal. Animal-assisted therapy for agitation and depression in nursing home residents with dementia. This was a trial in which they compared AAT, bringing animals in on a regular basis, and what that did for the trajectory of dementia. And those folks that participated in that program, as compared to the control group, they stabilized more with symptoms and did not progress. And then, of course, laughs. I think animals are funny. They do a lot of funny, cute things, and even if you don't dress them up. And these are all photoshopped pictures anyway. Implications for nursing. I think that when we're talking about for home care or for other situations, even if you're in the hospital or someone's in the hospital or wherever they're working, the things to assess would be concerns about pets. Are there pets at home? Are there concerns about those pets? Are there any health risks that are associated with being engaged with those animals, or things that you should be worried about? Immunosuppression can make a difference in terms of the type of pet or something that needs to be considered. Frailty, it's just always a choice for the person, but looking at the type of animal, what kinds of issues are going on, and how you can minimize risk would be important. You don't want certain animals might be a little bit more inclined to get tied around your legs and lead to falls or whatever. I mentioned about the bleeding risk and the person who worried about the scratches from her dog. Backup plans for animals. For people that, especially older adults, who are thinking about, well, what happens to the animals if something happens to the guardian or the owner? End-of-life issues for that pet. What's going to be the reaction? What are the plans for working with that person who's supporting him through the grief and loss, which is also listed later? The costs, as people on fixed incomes face higher and higher bills, medical bills, then where are they going to get the health care for the animals, or the grooming, the special food that the animals themselves might need, hygiene needs for that animal, just something as simple as changing the litter box or what the backyard might look like when the snow melts, all of those different things. And matching with the right pet if we're looking for a new animal. Animal-assisted therapy, there's many resources for that. You can start with looking at PAWS on doing a Google search for that to find organizations in your area that would help. Things that you have to keep in mind are facility policies. When we bring the dogs to the diag, it's okay that they're outside. We have to keep them in, we have very strict agreements with the university about where they will be, how much space will be around. We have to put little enclosures so that there appears to be some space so that we can control the crowd. Some buildings you will not be allowed to bring a therapy dog into unless you call in advance and get the clearance on that. If it's a service animal, that's ADA protected, so they'll be able to come in, but purely therapy animals, you would have to make sure that you had the permissions. For gap filling and home visiting, this is a big need. I'm really interested in what people would have to say about how to tackle that. Others in the environment, things to have to consider. Are there people who have allergies? Other people would have phobias. And especially if you're talking about home care, where you're bringing in service workers, home health aides, personal aides, nurses, or whatever. As you know, some people are going to have phobias about the different kinds of pets. They might be afraid of cats, they might be afraid of dogs, might be afraid of snakes. I remember one situation where the person had a snake. It was an innocent enough snake. It wasn't like trying to get out and attack people, but just the fact that there was a snake in the house made it very difficult to find a nurse aide that was comfortable with going into that situation. Same thing with allergies. I just had students doing home visits through Meals on Wheels, and it was a challenge because many of the clients had cats, and one of the students had a severe allergy to cat. So trying to figure that out. And of course, the costs for certain types of therapy are pretty large. Not so much with the TheraPaws. Those folks come volunteer with their animals, bring the animals, make all the arrangements, pay the gas, do all that kind of thing. But if you're looking at a higher level of finding more support for that interaction, you have to consider the costs. Emotional support in service animals, same thing in terms of resources. There are resources for those in terms of finding them. Like with PAWS and for a cause, being able to find particular animals and train them and match them. The cost should probably be up at the top because the cost for a service animal, these are specially bred animals. They are specially selected, trained, raised. There's a lot of cost that goes into doing that, and these costs generally have to be found from other sources and donors, since oftentimes the people themselves, people with disabilities, would not have the funding independently to pay for that. Liability, when we were doing even the TheraPaws, talk about that a little bit coming up. The TheraPaws people who have their therapy animals, these are certified animals. They're already covered by liability insurance, which is very generous. And this is quite an advantage to anybody who's trying to bring in other dogs or pets into their facility or to work with folks, is having this kind of protection. When we did our PAWS event, Dogs in the Diag, the first year The students said that this was a great idea, they were going to do this. They went and reserved the diag, and I said, "Are you sure you can have dogs in the diag?" He goes, "Oh yeah, no problem." I said, "Are you sure you can have dogs?" And she said, "Oh yeah." I said, "Did they know you were going to bring dogs to the diag?" "Oh yeah, we wrote it right on the application, they didn't have any problem with that." They said, "Well, they didn't ask you any questions?" I said, "No." The night before the event, yeah, we got a cease and desist order. You cannot have dogs on the diag. The students had posted that they were going to have dogs on the diag on Facebook. They had over 2,000 hits saying they were coming. And here we were thinking, oh my God, we can't have dogs. So the students were going to bring their own dogs that they knew, and dog people know that their dog is a nice dog and can get along with other people and other dogs. But non-dog people don't know these things. So, of course, everybody was just imagining this gigantic pit bull fighting thing on the diag or something where everybody was going to be eaten alive. So I spent about 3 hours on the morning of the first dogs in the diag, negotiating with the vice president of events, risk management, somebody else with a very big long title, and security, and public safety, and we had to work out an interim disclaimer consent form that people wrote for their own dogs in terms of assuming all responsibility for liability. After that, we had to go through so many hoops on Canvas trying to make that happen. What we found that worked was, again, hooking up with the Therapause of Michigan group. And since their dogs certified, already carry the insurance of something like $1 million, they're indemnified for the event. It was just amazing how the university was like, okay, you want to have dogs on the diag? No problem. So that was the solution. But of course, those all have to be considered in other areas too with the service animals. And the service animals themselves, because they're so costly, having some kind of protections in place for that. And they're so difficult to replace after they've been trained. So it's a big process. Access and housing can be an issue, especially for emotional support animals. If people have a visible disability, other people tend to be more accepting of everything, their wheelchair, their handicap parking pass, and of their service animal. But if you have someone who has more of an invisible disability, then it becomes perhaps more problematic. So working out relationships, particularly in housing environments or for other public places that someone might want to go, where they can have their pets, but also, or their service animals or their emotional support animals, but not infringe upon the preferences of others, can be a challenge. Let's see. Oops, do that again. Sorry. Pathological pet problems. Of course, I'm talking about all the great things that can happen. But there are other bad things. Everybody's read about them. You've probably encountered them. Hoarding, when people not only hoard other things, like papers and magazines and packages and other things, but also start hoarding animals, because they really don't know what to do about them or how to solve the problem. And that's a more complicated psychiatric condition than I'm able to address. However, there are some resources in Ann Arbor that would also, on the web, be able to provide some support on what to do about hoarding, especially when that involves some animals. Abuse and neglect of animals. Many of those service animal and therapy animal folks, they screen very carefully for what's going on. Paws of San Francisco, they're very strict about how many animals they will support. And if they see any sign of abuse or neglect, they will get right in there and they will stop their own support services, which seems kind of counterintuitive, but they won't be a party to that kind of a thing. So they will take action. So there's many resources from the Humane Society, the local public health department, especially with the pathological pet problems, can also provide some advice and guidance. And this site, the hoarding task force out of UMHS is quite, can you rephrase that question because I can repeat it. I think you were looking on the website and you saw an advertisement for emotional support animal.
To register your own dog.
To register your own dog as an emotional support animal.
So I just was wondering what does that entail? What would that, like if someone is in the hospital and their dog is registered as an emotional support dog, would that dog be able to go visit them at the hospital, or is it only like a, do you understand that kind of thing? Is what's-
Right. From what I understand of it, emotional support animals don't have quite as many rights as, for example, a service animal for someone who has a disability. Because then those animals are protected under the Americans with Disabilities Act. Emotional support animals are a little fuzzier area. That they do encourage people to have still some authorization or prescription from a physician or therapist that this person does need this animal in order to maintain their emotional calmness or well-being. You'd want to be careful how that would be phrased. So I think, Susanna, do you know some more about that area? Because I don't know a whole lot on emotional support animals.
You have to have a signage on them,
Yes?
and you have to have a doctor's recommendation.
Yeah. Okay. So that's about,
Because I know the therapy dogs have to be, have all their shots and have, all that kind of stuff. But would the same thing be the case for an emotional support dog? Do you know, I mean?
yeah, I think I know what you mean. You would still want to make sure to protect the relationship, for example, between that person and their landlord about this emotional support dog or their workplace or whatever. So that animal would still have to have their shots and meet all the health criteria. I mean, that would be good etiquette for that kind of situation. And sometimes nurses or others might be, for example, PAWS in San Francisco, they did a lot of advocacy around that very issue about the emotional support animals because landlords wouldn't necessarily recognize that dog or the animal as being necessary. And I think that also goes into that gray area between a physical disability and an emotional issue. The physical disability people can reason with that much more easily. But then anyway, so what's the difference between this person and they want Fifi with them or, nothing personally, Jill's Schnauzer. She wants to bring that to work or whatever. So people are it's a little more uncomfortable. I did bring, Annette. And over
Wires everywhere.
Yeah. This addresses this a little bit because it talks about fair housing amendments related to both the emotional support animals. I'm terrible at passing things out, especially when I have a short leash. Oh, and I'll probably need one to reflect on. But this is from the Iowa Civil Rights Commission, and this is a fact sheet that they had to try and give guidance to people who, you especially see this in a low-income housing situation, about what were the protections or issues under the Fair Housing Act and Americans with Disabilities. So, I think when you get to the So this is a fairly supportive policy from Iowa. They mentioned that state laws and regulations might also affect these things, but there is confusion related to that. And I believe when I read this before, so for example, the Americans with Disabilities Act only protects service animals in public places, not emotional support animals, and does not touch private residences. So there is some negotiation that would need to be in place, especially if there's any other kinds of behavioral issues with a tenant such that it would jeopardize their housing situation. So I know that the Laws of San Francisco, they had encountered this a couple of times, especially the emotional support animal is a very new term. It's like a few years old. So they were encountering a lot of pushback from different landlords in terms of how they would do that. So excellent question. I don't know the rules in Michigan, but be good to look into that. Social etiquette with working animals. To go back to that. So pets and pet therapy pets, especially those kinds of dogs, therapy dogs that go to nursing homes and to schools with kids, and for dogs on the diag. These dogs love to be petted. You can see them when the students swarm them, pet them, like for, just 5 or 6 animals, or students. I didn't mean to call students animals. Petting this dog, the dog is just laying there, and the students get up to leave, and the dog is like, hey, wait a minute, where are you going? Come back here. And they start getting on the leash to try and follow them. So they really want all of that attention, and it's interesting to watch. Of course, different animals have different tolerances for that kinds of things. Well, imagine birds, they're a little more delicate than that. Bunnies, for example, don't like to be picked up, and so it's very. I don't know that much about bunnies, but the bunny people at the bunny sanctuary would talk about what it is that you're supposed to do to handle the animal and where they like to be petted and how much and what kinds of circumstances. And that's important if you're trying to create that kind of arrangement. Well, cats, as we know, well, there's an interesting place, a cat cafe. Where is it? I'm trying to remember where it is. But just as we have dogs in the dive, some people say, what if we had cats in the cafe? Wouldn't that be cool? And there is a cafe somewhere, I'm trying to remember where there's just cats. You can go in there, you have coffee and tea, and you can get a little cat to sit on your lap for a little while. Fish, of course, handling is not advisable. But certainly they're quite colorful and wonderful to look at for the aesthetics, and even that has been found to be very relaxing. That's part of the reason why they have them in doctors' offices and things. Snakes, horses, not your lap animal, of course, a horse, but nonetheless, these animals, just being around them or grooming them or riding them or whatever, this can be a nice therapeutic action. And then there's other specialized kinds of therapy with horses, for example. Kids with disabilities riding horses helps with the balance as part of physical therapy, but also some emotional kinds of things. It's important to protect the animals from overhandling, especially if you're going to bring puppies. Like we love to have puppies when puppies are being socialized as they're in training, so to speak, or being groomed, so to speak, for being a service animal. They need a lot of socialization, but we've been advised not to have puppies less than 6 months old because they don't have very good immune systems. They can catch things from the people. And of course, people will, with bunnies especially and kittens, they really, or puppies, they really want to handle it a lot. So you have to limit the time. Again, I've mentioned the liability before. It's something that you really have to keep in mind. Dog owners in particular get real enthusiastic and think that, their dogs are, they've never bit anybody, don't worry. But in a crowd situation or an unknown situation, things can happen, so you have to have your protections in place. Again, still mentioning the allergies and phobias, and you'd have to be aware of were any of those things occurring if you're going to bring the animals into a public space or a classroom or a school or a library. People need to have warning. Infections can occur. That's why pet therapy, our animals, they all have to be, they'll have to carry the little cards, the owners do, that they're up to date. And we always keep a first aid kit when we have our events. We've never had a human being get hurt. At Dogs in the Diet, we did have, one of the dogs got, a kid on a bicycle ran into the dog. And it was a tense moment. I mentioned building policies before. These are things that have to be considered. Service animals, and I've got the pinkish, blockish around this box. Service animals are very different than the kids and adults and other people need to know that they can't, they shouldn't go up to any animal or dog without permission and to make sure it's okay. But service animals they're very much trained to be focused on just that one person. It's really impolite to go up to a service animal and start distracting that animal or trying to engage with it in any way, unless you have the permission from the person before calling attention to the dog or petting them. And of course, service animals, they get a lot more protections through the Americans with Disability Act. So,
At our church, one of the parishioners is training dogs or raising dogs for leader dogs. And usually at the 4 o'clock service on Saturday, the particular priest that's there will, if the dog's there, will go get the dog and hold the dog during his homily and stuff.
oh,
But we had one a couple weeks ago that must have been young and decided it wanted to bark. So we finally had to give it back because there was no stopping it. It was going to keep barking.
so for the purpose of the viewing audience in Florida, or Nancy was saying that at her church, they have members of the church that are helping to raise puppies for leaders, for the dogs for the blind. And so they bring those to the services. The 4 o'clock service on Sundays, that's a great recruitment to your church. And that one of
Well, I
the
think they're trying to
services,
socialize them.
they want to socialize them and to get them comfortable around people and comfortable in crowds, and comfortable with homilies.
Yeah.
Would be held by the pastor while giving a homily. Apparently, the dog then became possessed of a spirit and was barking in tongues throughout there. So, but that certainly is very interesting. This seems like I already said this, but again, we'll look at that later, working safety. Am I going backwards or did I already do
No,
this?
you're good. Some of your slides repeat, so.
They do. I have that problem. Sorry. I thought I cleaned that up, but obviously not. We talked about some of the access protection, care of the animal. All of the people that get into these programs, they have to be able to verify that they can take care of that animal. On occasion, there's some debate, you see it in the media, that the animals are being exploited. even for the plain old bloodhounds that go on therapause kinds of missions. It's really hard to think of the dogs in those situations as being exploited because they really do seem to love every minute of that. And the handlers will tell me that they even know when they're going to be working, so to speak, going for a therapy visit. And the dogs get excited and they anticipate that and they recognize when they're getting their little vest on or whatever.
Are
Yeah.
there certain kinds of dogs that are allowed to be therapy dogs, or certain ones that aren't, or is it?
The question is, are there certain dogs that are allowed to be therapy dogs and certain not? For the pet therapy type that goes for visiting, I've seen all kinds. Maybe pit bulls, bully breeds. I've seen those. I think I had that slide here somewhere in between the ones that I'm repeating, about how someone would go about having their dog approved or certified as a therapy dog. And it's not so much on the breed. People seem to be, of course, fearful of the bully breeds. So they might not be as receptive to that, but I haven't seen that kind of warning. I mean, we've had bulldogs. There's this one particular pit bull that's kind of like the mascot of a particular group, and people are really crazy about that particular dog and bring her around a lot. For the service animals, you tend to see more like Labradors, Golden Retrievers. I say Golden Retrievers.
Yeah.
I get those two mixed up. Sorry. Golden Retrievers, certain kinds of poodles, and of course the Shepherds and.
Yeah, I saw a shepherd the other day,
think
another
it's
lady I know has a
Pardon?
golden. I saw a shepherd at the grocery store the other day, and also a friend of mine has a golden retriever.
So, yeah, Shepherds and Golden Retrievers. And they're bred, the animals are bred for their temperament and for their intelligence and for their abilities. So,
Service dog.
these
Yeah,
service dogs, service dogs. Yeah, the other dogs, they have a natural ability, and then what they're looking for is more the personality of that particular dog, and that ability for that dog to be calm, not distracted by other things, and of course to be a love hound. Yeah, I don't know how else to put them. We have other words that we use sometimes, but since I'm on tape and broadcast across the country, I won't call them. But is your dog a potential professional? You could get them certified as a therapy dog, and this will give you the instructions on how to do that. This is only one. There's a few of them, but this is one, and this is the folks through Therapause. This is the organization that we work with in my student group the most. And this is just the branch, the Michigan branch of that. They are affiliated with the National, and the National is who gives us a certificate of indemnification for the actual dogs in the DIAG event. So all the dogs that come there from this organization are covered. The handlers aren't, it's very interesting, but anything the dogs do gets covered. This explains the requirements and also other volunteer opportunities. This doesn't talk about it in here, but I know we've had people come who actually volunteered just to raise those puppies, like the leader dogs. I don't know how they do it because they have to give the dogs up at some point. But on the other hand, very often they will get the dogs that are wonderful dogs, but just don't quite make it to the grade of being a leader dog.
That family that I was referring to, they did have one that they took all the way through the training, but then once he was assigned, apparently it wasn't a good match, or he was misbehaving, so they did end up taking him back as their own dog, because he couldn't pass the final test.
So Nancy was saying that indeed she had a friend that did that raised the dog all the way to the point where it goes through its training. And the training, I think it's 18 months or so.
3 years.
2 years, 18 months to 2 years before they're actually working with a family or a person. And sometimes it doesn't work out. The animal can't perform to the level that's needed. And sometimes the puppies, the people who raise them as puppies will take them back and make excellent dogs. Just not at that certain requirement. I think the dog from Until Tuesday was an animal like that. Didn't make it in a certain realm, but also became quite attached and quite effective with the veteran with PTSD. So there's other volunteer opportunities like that in terms of raising puppies or assisting with things, fundraising, other things. But the requirements they have a questionnaire that you fill out. They go through certain kinds of visitation or training. And it from what I've heard, it's certainly not super rigorous Lassie level kinds of things. Again, they're mainly looking to see how well the person and the dog gets along. Must have some level of obedience training, able to walk on a leash without pulling your arm out. Basic commands, willing to be touched by strangers. I mean, that's really one of the big things. And so there's some self-report that's going on here by the owner. And then the people from TD Inc., Therapy Dogs Incorporated, will also do some screening and interviewing and make sure that it's really true what it is. So there you go. Tested, observed, and if passed, registered. So if you think your pup could do that, so we're just about, I think that's the end. Just wanted to mention a little bit about, it's not all about the dogs, and guardians seem to get a lot of pleasure out of this. They really like the instant positive reaction of the people that they visited. Do you guys, anybody here do that? Go with your dog? And I've heard people say they've taken their dog and to someone who hasn't been responsive at all, or very minimally responsible, and just boom, like that, starts interacting, or at least showing more interest in people and things around them. They get a big kick out of it. They'll do this, people who are retired will do this quite a bit, going to many different places, and the dogs love it too, sleep better. And
I think from the
Yes.
nursing perspective, we do all these other assessment datas. We really need to be delving into who is your closest friend or who are your relatives. There was an incident in one of the hospitals in Minnesota where when they finally checked on it, the man had no family. What he was missing was his dog.
Yeah.
And I think they even let that dog come into the ICU after
Mhm.
some checking and stuff. So,
Yeah.
maybe part of our assessment, we should be asking those questions on admission, just to kind of get some feelers out there.
Really part of culture.
Yeah.
Yeah.
Do you have pets? Are you close to them? Do you walk them regularly? Just simple little questions that might get you some insight.
Or do you have concerns about them while you're here?
Right.
Yeah, who's taking care of them?
Right.
Yeah.
Yep. It seems to me there's been a lot more, when I look back 20, 30 years ago and to now, there's a lot more openness to allowing pets or therapy animals into, even to the holiest of holy ICUs or something, in the most intense situations. But I think you'd really have to evaluate the animal situation for that. Saw a great picture of a little kid in hospital bed, pulled to the side with this gigantic German Shepherd sharing the bed with him. So, at any rate. I think, whoa. Was there anything I said I was gonna do that I didn't do? Oh, good. And there were a few things I repeated, so I guess that's okay too. Let's see. And I think we're just about near time. I did want to show you this, but these tapes take a while. Oh, this would be my conclusion. Thank you very much. But if you are interested in more information about this, there's a series, PBS series about Through a Dog's Eyes, and this goes into a lot more depth about the different kinds of therapy dogs and how they're trained and the situations of the families and everything, and it's very captivating. This text here, the first one, Fine, Handbook on Animal-Assisted Therapy, this has great resources in there on models for example, when I mentioned Paws of San Francisco, they have the model types of program for dealing with some of the issues that might be related to immunocompromised individuals, HIV, people with HIV/AIDS. They have a very detailed chapter. This is just loaded with a lot of resources and references. If you want to start your own program, there's materials in there. And if anybody, you tell me should we talk some more about pets? You have stories you'd like to share? Yes?
I have a question.
Yes.
Somebody asked me if my dog would go for therapy to a 96-year-old woman to her home. She lives in Detroit. It's too far for me. How could I get somebody to visit?
Well, the question is, there's a person who's 96, lives in Detroit, would really love to have an animal visit, a dog visit.
Yes.
Okay. And how would you get someone to that person? That's an excellent question. And I think that going back to what the gaps are in providing that kind of service into the home, I don't know the answer. It would be, I don't have a dog, so I'd be willing to do that. But does anybody have other suggestions or ideas, or?
If she called the Humane Society, would they be able to give her some ideas or referrals?
They might. I have your card. I can see with some of our groups. I mean, I would call my buddy from Therapause to see what he could suggest.
Yeah, good.
Because I
Is
know
there-
Thank
I mean,
you.
Is that just in the Ann Arbor area, or are there,
No, they're all
okay,
over.
because,
Yeah.
you know, they may have a group that would go into the city,
Yeah.
you know.
It
No,
might be in the
but I
city,
guess
it's more of
a
the,
distance issue
Yeah,
more than the
right,
fact of
right.
her being afraid to go to the city.
yeah.
But
Yeah,
I mean, someone who would cover that area is what I meant.
right.
Yeah.
That's a great question. I'll check with my therapy buddies and see if they can put us in touch.
Well, there are dogs I know that go down to Children's Hospital.
That's right. Yep. I think, again, it's getting people to take their pets, a therapy dog, to an institution or a group situation or group setting. That seems to be more commonplace. But finding a program that takes the pets into an individual person's homes, that seems to be a gap there. So if anybody hears about that, really.
I wonder if, after listening to your presentation, I have a whole big understanding more of, I just never thought about it. Actually, I haven't had a dog for 30 years. We did when I was growing up, but somehow haven't. The cats I have now are feral cats, live in the garage. They adopted me. So,
They're giving a presentation right now.
yes,
About
They are spayed, I'm a
Human
certified
therapy.
feral cat caregiver.
Oh,
Yeah,
good.
Yeah, so they're, everything, they got heaven on earth in my garage.
Good for them.
But anyway, I never thought, and so if this family of Susanna's friend understood the value of the pets, they might even take her to a humane society or take her somewhere where there's animals that are being available
Yeah.
to enjoy, like a socialization time. But a lot of families, I'm sure, have no idea. They just think, well, it's just one of those things.
Well, I have to say, I want to comment too, because I always thought, well, this is a nice thing, in the hospital I work at, yeah, they have the dogs come in, oh, isn't that lovely, you know, whatever, you know. But then my daughter was hospitalized for a week, and she said that when they brought the dog around, that was, I heard her cry, she said that was the best part of the whole thing. She was so depressed being in the hospital, and her best friend was here from out of town, and she was stuck, you know, and she said that like just made the whole thing better. So it just really opened me up to the thought that, you know how important it really is to people to have that other, you know, something from the outside that's not a shot or a medication or
Right.
a doctor or, you know.
Yeah, something normal. Yeah.
Exactly.
A lot of the nursing homes allow
Uh-huh.
animals to come in. My mother-in-law was in a nursing home on the east side, and she was like clinically depressed, really bad, and she had helped raise our schnauzer, and so we took him over there to visit. You just had to show papers that they had shots and everything, and all the grandmas just loved him, and he would just jump up on her bed, and she would pet him, and, you know, she would start coming out of her shell a little bit, you know. So, but a lot of them do allow them in, so.
Some will have their own, the animals for the
Facility,
home, for
yeah.
the facility. Where my mom was at, they had one dog that went all over the place, and I think they also had some cats. It was pretty interesting. There's sometimes too, when say an older adult might be moving into independent housing or assisted living or things like that, then they might, depending on the size of the dog and the nature or the animal, the pet, they might be able to bring that. It's usually a fee or something. But then they'll also think about them as a community dog or a community pet as well. So maybe this animal, the pet can become, belong to more people. In trying to kind of control the population of pets as well.
Yeah.
In the residents. So those are good things to keep in mind. So,
Well, just as if when we see Alzheimer's patients who have no memory except that long-term memory, that could bring some things out. I can remember having students at a nursing home where there was a lady whose husband came in every day. She didn't know who she was or where she was, but he'd sit on her bed and sing old songs, and she knew every word to those songs. So there could be a tie into their past and an animal, too.
so if I'm supposed to be repeating those for the audience? Okay. So a couple things was talking about, the first story was how important it was for having the therapy dog that came to the hospital for Kathy's daughter when she was in the hospital. Prior to that, Kathy had thought, it was nice to have this pet therapy in the hospital where she was working and all that. But until her daughter was in the hospital, was upset about not being able to meet with her friends and engage in other things, having this animal, the dog, came to her bed. That was the highlight of her hospital experience, where it really made, relieved a lot of that anxiety and kind of just a feel-good kind of a moment with the dog. Jill was saying that, talking about nursing homes experiences with animals being brought in and being able to bring her schnauzer with a very friendly facility. All they needed to know was that they had the shots and was a well-behaved dog, and they weren't worried about that. Of course, that wasn't the University of Michigan. So we had to have more bureaucracy. That's one of our specialties. But still, those kinds of situations happen, and it depends on the mood too, the atmosphere, the culture of a particular community, on what they're going to be able to facilitate and be open to. Somebody else said something, Nancy was saying about how animals in that situation can help folks with Alzheimer's or dementia or other memory problems, just trigger a lot of different memories and about having pets and being able to enjoy those memories or bring back some memories, or at least have the interaction with the animal. Did I miss anything?
Yes, fantastic. You have a great memory.
I'm reading my slides.
And something in a situation where there's a death of a family member, especially a mother or a parent, and there's young children, and another eventually maybe step-parent comes in, it would be so important to have the pet remain with the family if possible. Because I
That's a
think
great
that
point.
really adds that much more continuity
Right.
within the home.
That's a great point. So the point of the suggestion is if there's a death in the family or a splitting, a divorce or separation or whatever, being able to maintain stability with the pets in that situation can ameliorate some of the stress associated with the loss and the grief and the disruption. And I think Maureen was saying that her daughter had suggested, would it be great if they could bring a therapy dog on their way to a funeral, if they could bring therapy dog to the funeral. In certain crowds, that would be probably quite welcome. I think they brought therapy dogs to the Sandy Hook Elementary when the kids were coming back. Because of reasonable fears associated with doing that. There will be lots of different opportunities, and at least for many people, not all, that would help to absorb some of the emotional tension. I gotta get a dog. All my cat specializes in is looking like a hat. That's what we took. Oh, look, now she's a Russian hat. Oh, look, look at the way she sleeps. Now she's a talented cat.
Well, thank you very much.
Thank you.